Hi, Dr. Scott Jensen. I am running to be the next governor of Minnesota. I want to do a quick article review for you because you may not have seen this. It's written by Dr. Kheriaty, a physician. The title is Why I Am Challenging in Court the University of California's Vaccine Mandate. He says this: I recently filed a suit in federal court against the University of California, my employer, challenging the constitutionality of the institution's vaccine mandate on behalf of COVID-recovered individuals. Natural immunity following COVID infection is equal to, indeed superior to, vaccine-mediated immunity. Dr. Kheriaty is a bioethicist, chairman of the Hospital Ethics Committee, and a psychiatrist. He says this: inconvenient scientific findings are now routinely ignored. Reasonable questions are forbidden, and many scientists and physicians feel intimidated into silence. Among the most glaring failures of our response to COVID is the refusal to acknowledge natural immunity of COVID-recovered patients in our mitigation strategies, herd immunity estimates, and vaccine rollout plans. The CDC estimated that as of May 2021, more than 120 million Americans had been infected with COVID. He goes on to say, fully vaccinated individuals were 6 to 13 times more likely to get infected than previously infected unvaccinated individuals. The risk of developing symptomatic COVID was 27 times higher among the vaccinated compared to previously infected, and the risk of hospitalization was 8 times higher. Furthermore, there is now considerable evidence that COVID-recovered individuals may be at higher risk of vaccine adverse effects compared to those not previously infected. Then he says, I have spoken to many students, faculty, residents, staff, and patients who are aware of these basic immunologic facts and are asking legitimate questions about vaccine mandates. Many correctly see no medical or public health justification for subjecting themselves to the risks of the novel vaccines when they already have superior immunity. He then goes on to close with this: I have nothing personal to gain by this lawsuit and a lot to lose professionally. In the end, my decision to challenge these mandates came down to this question: how can I continue to call myself a medical ethicist if I fail to do what I am convinced is morally right under pressure? Please, let's all think about that. He's putting his career on the line. Thank you. Thank you, Dr. Kheriaty.